That was the last that they asked you about. And correct me if I'm wrong on any of these dates or facts. She was admitted on the 24th of January. Is that correct?
Yes.
And do you have a memory as to approximately what time was it in the evening?
Well, she got to the ICU, it was around 3.
Okay. You're very soft-spoken.
Sorry.
If you can just keep your voice up so all the jurors can hear you.
She got to the ICU around 3 a.m.
Thank you. And she came by med flight?
She came to me from MRI.
And MRI obviously would be when you're taking the pictures.
Picture,
And that would be on the 24th of January in the early morning hours, correct?
I think it went into the 25th.
Into the 25th?
I think so.
Counsel asked you about the whiteboard that she would write on. And I think it was, again, if I'm wrong, correct me, was it January 28th that she used for the first time the whiteboard to communicate?
Yes.
And the whiteboard basically is just a whiteboard, and,
Yeah.
and you write on it.
Erasable.
And she was not able to speak because she was intubated, right?
Yes.
And she was in the restraints that you've described as well, right?
Right.
Moving forward, January 28, 29, 30, into February 1st, February 2nd. It was on February 2nd that counsel asked you about her asking to reach out to her lawyer, correct?
Yes.
And do you know who her lawyer was at that time?
No.
Had you seen him before?
No.
Did you know, is his name Attorney Gelb?
No.
Make any reference to you?
No.
Do you know that whether or not she had conversation with Attorney Gelb regarding her status as being under arrest by the numerous police that were guarding the room?
I don't.
Do you know whether or not she was ever able to talk to Attorney Gelb, or did you refer her to the social worker people?
I put in a consult for the social worker.
Okay, thank you. When she was admitted on the 24th, would you agree that she was in the state of cardiac arrest shortly thereafter?
Shortly after arriving to me.
So I'm looking at the medical records that have been introduced for the jurors, and I'm referencing on page 18, if I may. Now, this is one page of 400 pages of medical records.
Can you see that?
But
All right, here we go.
looking at this, does it indicate it's an SICU course?
Surgical ICU.
I'm sorry?
Surgical ICU.
Okay. And that makes reference to the fact that shortly after arriving in the ICU, the patient had a cardiac arrest. Is that fair?
Yes,
Were you there then?
I was.
And when it says the etiology of the arrest, she got 2 rounds of CPR before obtaining ROSC. Can you tell me, please, what is CPR? 2 rounds, and what is ROSC?
Meaning we did chest compression. She was already intubated, so she was getting oxygen.
Okay. And then bilateral chest tubes were placed in her body?
Yes,
Does that mean from both sides?
both sides.
Okay. And that punctures through the chest into what, the lungs?
The lungs.
Okay, the lungs. And when they placed the chest tubes, at this point, shortly after admission, there was 100 to 300 cc's of blood from each chest tube? What does that mean?
That's the output they got once they put the chest
Sorry,
tube.
again, just can you keep your voice?
That's the output they got once they put the chest tube in?
Okay. So when they put the chest tube in, it drained 100 to 300 cc's of blood. Is that correct?
Correct.
And then after that, again, shortly after admission to the hospital, coming from South Shore Hospital, she then got a massive transfusion protocol, which you told us about, right?
Yes.
And what does that mean?
Means she gets, we have a protocol that would blood, depending, blood products.
Okay.
She gets infused rapidly.
And was there a notice shortly after arrival to the ICU, she was being turned and had 30 cc's of clear fluid that came out of her nose? Is that right?
Yes.
And what is that? Was there a suspicion that that was what's called CSF?
Yes.
And what is CSF?
It's spinal fluid.
Okay. Going to the next page, which would be 19, does it indicate, again, on there, if I can just bring this up a little bit better. So she now has noted acute blood loss, anemia, right? What does that mean?
She has a low blood count.
And you know what happened to the blood, or any idea?
I do not.
So she had very low, lost a lot of blood, right?
Yes.
And she had anemia. That would be what, low blood or something?
Yes.
And she required multiple transfusions immediately following her arrest, right?
Yes.
And when it says arrest, does that mean arrest by the police, or does that mean the cardiac?
Cardiac.
I want to make sure that's clear. It's cardiac arrest, nothing to do with the police, okay. And she had required multiple transfusions. And you were there for that, correct?
Yes.
Were you aware of the extent of after you had the after you had the MRIs and the CAT scans, were you aware as the lead nurse or treating nurse as to what the extent of her injuries were?
At that point, I don't believe so.
At some point, did you become aware of that?
Yes.
Okay, so, and again, I've got the records, you don't, so let me do it this way, just to make it easy. Do you remember that she had a burst fracture of C1?
Yes.
What does that mean?
Means a cerebral fracture.
That'll be up here? So this is the cervical spine
Cervical.
up here?
Mm-hmm.
And then T5 and T6, there was a transection. What does that mean?
Thoracic.
Okay, so
On
that'd
the
be
spine.
about down here.
Yeah.
And when it says transection, what does that mean?
It's severed.
And then T1, 2, 3, 4 also were injured as well, right?
Mm-hmm.
What is neurogenic shock? What does that mean? If you know.
Neurogenic shock.
Sorry, yeah, neurogenic shock. It just makes reference on.
These are not my notes, so I can't really